and this is my final project for the History of Medicine, Bio 318. And my chosen epidemic is typhoid fever. So the history of typhoid fever is actually very interesting and a little bit longer than what most people tend to think of as far as the known outbreaks. So, although the most well-known outbreaks of typhoid fever have happened in the last century, typhoid fever is a disease with quite an interesting past. And potentially, it has been causing historical havoc since the time of the Greeks. So some historians have actually hypothesized that typhoid fever was responsible for a widespread plague in Athens in 430 BC. And it potentially proved fatal for 1/3 of the population of the time, including the leader, whose name was Pericles. His successor, Thucydides, also contracted the same disease, although it did not prove fatal for him. And this is the first known speculation of the occurrence of typhoid fever that's actually documented. According to the American Society of Microbiology, though, approximately 85% of the population of James River, which is an English colony in Virginia, was also thought to have died out as a result of typhoid fever. The fever proved fatal for more than 6,000 settlers at the time, and that ranged from 1607 to 1624, and it's speculated that it may have even been responsible for eliminating the entire colony. Military and war environments have often been subjected to the presence of typhoid fever throughout history as well. An excess of 80,000 soldiers were thought to have died as a result of typhoid or potentially dysentery during the American Civil War. Likewise, the Spanish and American War led to infection with typhoid in both the field and in the training camps. The discovery of typhoid was actually Pierre Bretonneau, who was a physician in France at the time, and he was believed to have been the first to identify the specific features and symptoms of typhoid fever during an outbreak in the French countryside. A second documented incident by an English doctor named William Budd, who was responsible for treating a separate outbreak of typhoid in 1838, when he noted that the poison, as he then called it, was present in the excretions of the infected and could be transmitted to healthy people through contaminated water consumption. Upon realizing this association, he suggested isolating the excrement to help control future outbreaks. In 1880, Carl Joseph Ebert first described the bacillus that he suspected was the actual cause of typhoid, and he was a German pathologist. And then in 1884, a second German pathologist, George Gaffke, confirmed Ebert's suspicions, and the organism was given the names such as Ebert's bacillus, Eberthella typhi, Gaffke-Ebert bacillus. Today, the bacillus that causes typhoid fever is known by the scientific name Salmonella enterica serovar typhi. Throughout the 20th century, the incidence of typhoid fever has steadily declined, which is mainly attributed to the introduction of improvements in public sanitation and personal hygiene. The chlorination of drinking water is also another big movement in water sanitation that is speculated to have made a significant impact on the number of individuals affected by the disease in developed countries. So, what is typhoid fever? This infection has many different symptoms, but typically presents with fever, body aches, loss of appetite, headache, diarrhea, and fatigue. As the disease progresses, delirium, severe constipation, dehydration, and even death may occur. If the patient survives the infection, the typical duration of typhoid fever is 3 weeks. There has also been evidence of other less common symptoms like rashes and internal intestinal changes called Peyer's patches that are viewed upon autopsy of deceased patients. In the decades before the Civil War, typhoid fever was thought to be caused by impure air and poisonous miasmas. But by the 1860s, physicians still could not agree on a separate and distinct cause for the disease. It was William Budd's published paper, Typhoid Fever, in 1871, which he argued that typhoid fever was a specific disease with a specific cause and was spread through contaminated water. However, his views were only beginning to create possibility with physicians during and after that Civil War. Regardless, many of the physicians during the Civil War continued to believe that typhoid fever was still a miasmatic infection and was transmitted through excremental discharges, contaminated water or food, or by an unknown poison in the air. So, the early treatment of typhoid fever by physicians before and during the Civil War included a variety of treatments, and many of those were the administration of substances like turpentine, quinine, brandy, and quinine sulfate. At this time, though, hygienic measures were considered the most important way to avoid getting typhoid fever. Unfortunately, most of the therapeutic remedies offered little relief to the sufferers, so physicians were encouraged to perfect strategies of prevention, and this particularly included cleanliness in the camps and hospitals, properly prepared food, and well-situated latrines, rather than to rely on the cures that were available at the time. After 1900, particular protocols began to appear from several different medical societies. One such protocol that I looked in depth into was written by a man named James Barr, who was a medical doctor at the time, and was published in the Lancet. In the protocol, Barr addresses general management, as well as dietary management, medication administration, and most of that was to combat pyrexia, hemorrhage, constipation. He also even included a section on intestinal perforation and peritonitis that could potentially need surgical correction. Although he did state in his protocol that if these conditions were suspected, the patient's survival at that point was extremely slim. The main medications that Barr discussed, in addition to the previously addressed Civil War era substances, were calomel, opium, saline, sulfate of soda, and castor oil. In his protocol, he also addresses supportive care with warm water baths, cold compresses, abdominal compresses, and enemas. Modern treatment of typhoid is actually quite different than what it was during the pre-Civil War and Civil War eras. Our improvements are in the understanding of typhoid fever itself, and also the development of antibiotics, although I will address some problems with that that has happened in the past several decades. One of the other big improvements is a more in-depth understanding of the toxin that is excreted by the bacteria following the infection, and we'll also address that. Um, there are some unfortunate complications, and I did mention this already, that have developed over the past several decades, and this is mainly the antibiotic resistance that is now complicating the previously standard treatment protocols. Um, there has now been the identification of both medication resistant and extensively drug resistant typhoid. Um, so this presents more problems for the treatment with antibiotics. They're having to use some more heavy duty antibiotics, and even then, it's mainly supportive care that they are looking at. Uh, Antibiotics have historically been the best method of treatment and have ensured the highest survival rate. So this is a massive problem. Also, the fact that the vaccine does not provide complete protection, and there are two different vaccines, but they are they aren't perfect. No vaccination is perfect. So they do still, if you're going into a third world country, um, strongly suggest that you follow preventative strategies where typhoid is still prevalent and water sanitation is still a problem. So those strategies are hand washing, boiling of water before use or consumption, avoiding raw vegetables and fruits that cannot be peeled. And when you do eat raw fruit or vegetables that can be peeled, wash them thoroughly and peel them yourself. And wash your hands with soap and water first. And do not eat the peelings. You should avoid foods and beverages from street vendors. You should ask for drinks without ice, unless the ice is made from boiled or treated water. Avoid flavored ice and juice because they may have been made with contaminated water. Always choose hot foods. Eat foods that have been thoroughly cooked. And they also discuss control of flying insects, so flies, mosquitoes, things like that, and ensure that all cooked food is covered to protect it from flying insects, and avoiding meat that is undercooked. So, typhoid fever has been one of the most interesting and eye-opening illnesses in history. Although this presentation does not focus on Mary Mallon, aka Typhoid Mary, the situation that surrounded her and asymptomatic transmission of typhoid in general, and the eye-opening aspect of asymptomatic transmission of illnesses is one of the most interesting and challenging aspects of the many outbreaks of typhoid. And that actually occurred in New York in the early 1900s. The causes of the severity of the disease and symptoms of S. typhi have been poorly understood, but there is evidence that the severity of the illness is linked not to the bacteria itself, but due to the typhoid toxin that is excreted after the bacterial infection is firmly established in the body. This is newer information and obviously was not available during the pre-war era outbreaks. So this has been a development over the past several decades. We do know that the typhoid cereivars of S. enterica are unique in their ability to produce this typhoid toxin. And how this endotoxin contributes to the disease is not yet clear, but the immune system and central nervous system are the suspect targets of the typhoid toxin. The 1600s and 1700s were a period of change and uncertainty in both Europe and North America. Few factors threatened survival as much as the invisible pathogens that caused deadly diseases. Unfortunately, the ignorance of the pathogens they were exposed to and, in essence, spreading, created a large amount of devastation that these early infections unleashed as they spread throughout the early colonies and the indigenous population of North America, as well as the populations of Europe. Although modern advancements in medications has reduced its prevalence in developed countries, there are still regions in the world that suffer from typhoid, and there are still risks of death due to the increasing amount of antibiotic resistance that is beginning to occur. Ultimately, though, typhoid is an almost unknown problem in countries with sanitation and clean water. Thank you.